According to the International Diabetic Foundation, India is the global capital when it comes to diabetes, and women have it worse as compared to men. Well, why exactly is it so? Statistics say that 10.8% of women who are between the age of 25 or after 25 are present with pre-diabetes conditions. So why is this exactly happening? Let's talk to Dr. Devi Gayathri, the consultant physician and diabetologist of Royal Care Hospital. Thank you so much for talking to GoiPost, Doctor. Doctor, why this disparity? Why do women present with these kind of conditions, I mean diabetes per se, as compared to men?
As we all know, both men and women are not same. Physiologically, the body condition and everything is very different, okay? And the main cause for this is the hormones.
Okay.
The main hormone is very different from the female hormone.
Right.
Okay. And coming to the risk which is associated with diabetes, like cardiovascular complications or kidney diseases, are even more worse when women with diabetes has these.
Okay.
And as well, we know in our in a country like India, where there is so much of environmental factors, social factors, where women are not exposed to healthcare facilities,
right,
then all these factors are very contributory to the worsened condition.
Okay. When going by your practice, what is the age group of women that you see nowadays? I mean, is it declining by the year, in the sense the age group that the women range?
Yes, definitely. Okay. Initially, maybe it was like middle age, or
right,
except for the type 1 diabetes, which presents even more earlier.
Right.
As we all know, and we are getting into urbanization, where many of the Indian women are working, taking night shifts,
right,
and they are following more of sedentary lifestyles, where they are not following proper diet, exercise, and and as such, they are more stressed, and there is lot of change in the dietary habits as
right,
well. Okay.
Yeah.
So all these are also contributing to early diabetes in younger women.
Okay. Doctor, is there any specific career that where you see diabetes mellitus is more?
This as such, we can't generalize like that.
Okay.
But we do see in more common in IT crowd, or people who follow more of sedentary lifestyles.
Okay. So what are the risk factors when it comes to women with diabetes?
So first and foremost is obesity.
Okay.
The female
most women are obese.
Most women are obese. Okay. Second thing, and actually WHO says that women are more obese than men.
Okay.
The range is what they give is like around 7 to 36% of women are obese.
76.
7 to 36.
7 to 36%. Okay.
Whereas when it comes to male, it is around 5 to 23% only. Okay. So when there is obesity is a major risk factor. Okay. Then we have you all must be knowing, and it's very prevalent, PCOD.
Yes. Yes.
Polycystic ovarian disease. Okay. That is a disease which causes, I mean, it's part of a syndrome which causes a lot of hormonal changes, and which in fact increases the insulin resistance. So if you ask me what is insulin resistant, I would tell, the body has to respond to an hormone in a normal way.
Right.
But when there is insulin resistance, the body doesn't actually act in a normal way which it is supposed to be. So even though there is enough of insulin in the body doesn't take up, and there is increased glucose. So this is called insulin resistance. Okay. And another thing is, as such, even a menopausal women is more prone to get diabetes, yes, because the estrogen is protective for us. Okay.
Yeah.
So as we know, in the menopause, the estrogen is coming down, so we have more chances of getting diabetes. Okay.
So doctor, sorry to intervene. You said that when there is estrogen production, especially in the case of women, I mean, obesity, diabetes is correlated with cardiac problems.
Yes.
But at the same time, when there is production of estrogen, a lot of production of, estrogen is produced in women. That's kind of insulation to cardiac diseases. So how does it work, isn't it?
See, actually, you asked me women are more protected against cardiovascular diseases. Yes, because of the estrogen effect. Okay, in premenopausal ladies, definitely we are less exposed to cardiovascular diseases as compared with men. But postmenopausal, we are almost at the same risk. Men and women have equal risk of cardiovascular diseases. But in a premenopausal women with diabetes, we don't have any protective mechanism. It is it is more worse in women, they say.
Okay. And what are the challenges that women with diabetes face, and what are the conditions they present to you with?
Usually the symptoms are almost same as what men experiences, like increased thirst, and they have increased hunger, urination, increased frequency of micturition, or they have a delayed wound healing, or some skin lesions they keep on having frequent. And another thing is usually the women experiences is the vaginal discharge, which is very common, and itching in the genital area, which is specific for women. Otherwise they present in the same way as men.
Okay. And doctor, what are the psychological effects that women tend to have because of?
It is a fear, first of all, the fear of the disease. Okay. They are very worried, like they feel that the whole of this thing life is going to be a big burden for others. And in Indian women, we have a lot of stigma towards us, the practices, and we are still, though there are few women who have come forward out of all these bonds, we still have Indian women who are still into these bonds. Okay, so they are not having enough facility to go for the healthcare, seek healthcare advices, take proper medications, or they don't even follow the dietary habits or medicines or lifestyle changes which we advise them.
Okay, what would you advise, doctor, in terms of dietary as well as lifestyle changes?
Concerning the diet, see, the diet is not a generalized thing for any of the patient. It is very different for different people. We have to individualize even the diet. Okay, so because we know two persons are same, they have their own practices or they have their own choices of food. People are still confused, like what to eat, how much to eat, what frequency to eat.
Right.
Okay, because people think that if you keep on eating more, maybe our sugar levels will be high. What they tend to do is they skip meals. Okay, and in fact land in more complications. Actually, we advise a short, small and frequent meals, which will keep the sugar levels almost in a constant manner.
Okay, we see a lot of women taking to alternate medicines nowadays, be it Siddha or Ayurveda or homeopathy. How much do you think that would work?
As such, I have no much idea about the alternate medicine, but see, something like if they are taking in a natural way, I don't mind. But if patients are coming to me like telling this, can I take this powder or this drink which is going to bring down my blood sugar level, I usually tell them no, because I don't know what is the content and what is the side effects of it. Okay. Like if you're coming to allopathy, we know what the way the drug acts and what are the side effects as well as the benefits. So it is easy for us to weigh the risk as well as the benefit. But we can't do the same with alternate medicine because I have no idea about it.
Okay. So doctor, how is diabetes associated to infertility?
Yes, when patients, women with diabetes, they usually have a lot of menstrual irregularities.
Right.
Okay, some people have very delayed irregular periods, you can tell, and some people have very less flow and all those things. Okay, so women do experience like what is called as female sexual dysfunction in diabetes.
Okay.
So when we control the sugar, they do definitely benefit. So infertility is also one of the main symptoms like patients present with.
So what should a woman do to ensure that she doesn't get infertile because of diabetes?
If they are already known diabetic, I think they should adhere to proper treatment. And treatment in the sense is not just medications. It is more of lifestyle changes as well as diet and then medications.
Okay. So what according to you would be the ideal treatment for women with diabetes, doctor?
Treatment for diabetes is very much individualistic. Okay, and the foremost thing which we concentrate here is diet. Okay, and diet plays a very important role in control of sugars. So we here give them a proper diet counseling, like according to their practices as well as according to their lifestyle, and how much of like whether they are sedentary or active and everything. We calculate the calories according to their need. It is different for different person,
right?
And also sometimes we weigh according to their weight also, and give them a proper diet chart. And we in general to tell it is small and frequent meals, okay, and they are supposed to take plenty of high fiber diet, okay, and it should be rich in protein as well as almost well balanced to meet other micronutrients also.
Okay. Do you see diabetes going up among the younger population? What would you advise at school levels?
Yes, definitely there is increase in the incidence of diabetes and in young age. So what I would advise them is not to go for any of the processed food, okay, to consume more of fresh fruits and vegetables, and to as well most of them are now very much addicted to mobile and screens.
Right.
They should go for physical activity, which will definitely help them.
Okay, so what role do you think that the schools and colleges, educational institutions per se, should play when it comes to containing the lifestyle related diseases
in school, right?
In schools and colleges.
Yeah. Okay, first thing, we have to follow a proper diet. I think most of the schools now provide diet in the school menu.
Really,
so
they have a canteen full of junk.
Yeah, along with that, I think the canteen system should be taken away, and it should be more of the balanced diet which should be provided to the kids, okay, and encourage them to a lot of physical activities. That will definitely make a difference.
Okay, thank you so much for talking to Go Ahead, Doctor. Thank you.
Thank you.